evening. And she has a wealth of knowledge in this area, and we're so blessed to have her share this knowledge and expertise. So thank you, Annette. And we also have neurologist Dr. Stephen Hardy here. He'll be joining us at the end of the presentation to answer any questions along with Annette. So please use the chat feature. During the presentation, you can use the Zoom chat feature to type in some questions, and then we will give those to the doctor and to Annette at the end ourselves. So you don't have to say it out loud. We'll do the talking for you. Just so you know a little bit more about Annette, she's an education director for Comfort Keepers, a home care company in Rochester, Michigan. She has spent over 18 years working in the home care industry, and she prides herself on providing the resources needed for families to help decrease their stress. What a wonderful profession. Beautiful. As a certified dementia practitioner and Alzheimer's support group facilitator, she is passionate to help, educate, and support families as they navigate the world of dementia. So I will now pass the mic to Annette.
Well, thank you very much. First, I want to thank Stephanie and Marianne for having me tonight with Dr. Hardy, and I look forward to answering some of your questions. I'm going to share my screen. Tonight, we're going to talk about understanding communication and behaviors in dementia and some helpful strategies to provide safe and effective care for your loved one. And every person that has dementia has a unique set of abilities and care needs. And over time, that as the disease progresses, this changes. Yet even when the disease is at the most severe time, the person can experience joy, comfort, and meaning in their life. Typically, they lose their short-term memory skills. But habits are part of a different memory structure in the brain, and that tends to remain intact a little longer. So by sticking to the same routine, your loved one doesn't have to stop and think about what to do next. It becomes automatic. So components of a routine, just think about some of your routines. Every single person has a different routine in the morning. Some people want their coffee first. Other people want to take a shower. Some people want their breakfast. Some people want to go jog. So every single person has a different routine. And being the spouse or care partner of someone with dementia, you know that person best. So in the morning and the evening, here are just a few samples of what a routine might look like. Using the bathroom, washing your hands, brushing your teeth, combing your hair, putting in a hearing aid, getting dressed. Maybe you wash your hair on certain days in the morning, or you may bathe in the morning or bathe at night. You might take pills in the morning and at night. So you develop a routine. So maybe your routine is that, and say, okay, I'm going to get up. I don't want to get dressed right away. I'm going to go into the kitchen. I'm going to take my medicine, and I want to sit in the recliner in my bedroom, in the living room. And I think I'll just stay there for a while before I do anything else. Or maybe that individual attends adult day services. Or maybe they want to bathe, but they want to bathe at night. So using a routine as a tool is critical. You alone as a care partner knows what their daily rituals are, and you can keep in mind what those routines are going to be. And as the disease changes, you may have to alter those routines a tiny bit, because there's a possibility they may struggle with all of them, and in that case may need some of your help. Some examples of routines, again, personal hygiene routines, mealtime routines. What is your mealtime routine? What does the preparation look like? What does serving look like? What does eating and cleanup look like? Did your care partner help you with those things? That's all part of a routine. What about household chores? Did they help with laundry? Did they help clean the house? Did they help with gardening? All of these things are things that they could be successful at because they are rituals that they've done before. There are daily tasks which go into their procedural, or habit memory. So identifying the routine. Oops, I want to go back one. Identifying the routine. Maybe in the morning, you dress for the day and your routine is you and your wife or you and your husband go take your dog for a walk. Maybe you decide you want to go outside and just sit outside with your coffee or tea and enjoy your garden or enjoy looking at the birds first thing in the morning. This is part of a routine. But what if your children say to you, hey, Mom and Dad, we're going up to the cabin and we'd like for you to join us. So here you are taking your husband or your spouse up to the cabin with your extended family. Well, your loved one who has dementia may find this very unsettling. Why do you think they might find this unsettling? Anybody want to speak up? Well, is it part of their routine?
Nope.
No, it's not part of their routine. And so many families, especially at the holidays, will say to me, I took my mom or I took my dad over to my sister's house to celebrate Christmas or whatever holiday you celebrate during that time. And we were there 15 minutes and my mom said to me, I want to go home. I don't want to stay here. So there you are. Are you a little frustrated? Yeah, because you got mom dressed, you got her going, you get her to the house, and she wants to go home. Why do you think she might want to go home? Oh, I have a quiet group tonight.
Because
Well,
she wants her routine.
she's in her unfamiliar surroundings for one. It's not her home.
Exactly. She's out of her environment. Her surroundings are unfamiliar to her. Not only are the surroundings unfamiliar to her, do you think, I don't know about you, but when our family gets together at the holidays, it's chaos. The kids want to open the present, it's noisy, it's overstimulating. So these are things that you want to watch out for if you're a caregiver. Sometimes it's so much better to have a smaller celebration than have something that will frustrate them. I'm going to make this. So the next thing is retaining important rituals. Maybe you and your wife enjoyed eating in front of the television set while you had your dinner. You got your tray tables, your TV tables, you'd set them up and maybe you watched your favorite show. Maybe you watched Wheel of Fortune or you may like watching the news, but that's what you and your wife did every day. Is that a habit? Yeah, it's a ritual. So by continuing this habit every day the way you did before, you're cueing the person with dementia to eat, and it also serves as a bridge for them to have positive memories when the two of you sat down in front of the television set. So it also cues them to have something enjoyable. Questions? All right, removing distractions and limiting choices. Do you ever go to a closet and you open it up and the person has 25 shirts and pairs of pants and skirts? That's a lot. For someone who has a dementia, it's too much. Too many clothes, too many possible outfits, they cannot make that decision. So it's important to weed out that closet when they're not around, and maybe offering 2 possible outfits for them to wear. If there's something in the closet that's distracting to them or in the bedroom, you may actually have to remove it so that they can pay attention to maybe your 1 or 2 choices. Recognize that change may be necessary. Well, as you well know, as the disease progresses, many times they can't do the things that they did before. And Maybe your husband used to help you set the table every night, but now his disease has progressed and he's not quite sure what to do with the silverware. And you want to hurry and you decide, I'm going to just set the table. Well, he can do something, whether you give him the silverware to hold or point to where he puts it down, or maybe he holds it until you get the table set and he can hand it to you. It still makes him feel like he's part of the process, that he has a tendency to feel worth something, not that he can't do anything. And if you don't think that an individual with dementia feels that they don't have any purpose in life anymore, you're mistaken, because they do feel that way. So make sure that you, oops, I think I passed one. Where did it go? I did pass one. I don't know where it is on my slide, but always recognize that when you have family coming over or you have children, make sure not only yourself is educated, but your family is educated. Educate them on where your spouse is, what level they're at. Educate them on what maybe their routine is so that they don't disrupt that routine. Before maybe old friends visit, give them some communication tips on what they need to say to your loved one. Don't have them ask them too many questions. If they were friends years ago, maybe bring up things that they enjoyed together years ago, because as an individual with dementia, they can't remember current things, but they definitely can remember things from the past. So you want them to feel successful in the conversation, but not overwhelming. Because again, if someone is giving you question after question and your brain can't work that fast, or they're talking too fast, they're going to get frustrated. And above all, stay flexible. If every day you can't plan an event or schedule an activity in advance, as you know, unforeseen things occur and it interferes with your routine. If that's the case, do the best you can and start that same routine that you were on the following day. Just make sure you start it. So here's an example of an entire morning's routine. Maybe washing yourself, brushing your teeth, getting dressed, preparing and eating breakfast, having conversation over coffee. And I've heard so many times from families, well, I don't know what to talk about because they don't understand. Well, maybe just talk about the things you're going to do that day with your spouse, or talk about what you're making for breakfast. Include them in the conversation. Just don't have them sit there. Many individuals who have dementia had a habit of looking through the newspaper. I had a client, he looked at the Wall Street Journal every day. Well, as you know, after a while, he couldn't comprehend in the Wall Street Journal, but he knew he was looking at it every day. It was part of his routine, and we did not take that away from him, even though we knew he couldn't understand what he was doing, but it made him happy, and that's all that counts. Maybe try a craft project during the day, or reminisce about old photos. But don't feel you have to have an activity after an activity after an activity. That's exhausting for them. That's exhausting for you as a caregiver. Take a break. Have some quiet time. Maybe listen to music. Go sit outside if it's a beautiful day. Do some chores together. If you know your wife used to love to clean house and she's making motions all the time with her hands, put a dust rag in her hand and show her what you want them to do. If she enjoys sweeping, give her a broom. If it's not the best sweeping job in the world, do it later when she's not around. Take a walk. Exercise is so important for an individual who has dementia. Play an active game. Maybe the individual loved playing cards, but now playing cards with a structured, list of things to do, not to do, especially a lot of people play bridge. It's overwhelming for that person. But maybe they still can recognize numbers. So you can do high, low numbers. The one who has the most cards wins the game. You can do black, red cards, sort them that way. Use your imagination. The one who's going to know the best about their loved one is you. I don't care if you have a home care company come in, you need to give them a profile. Who was your spouse? What did they do? What did they love? What were their hobbies? What's the thing they enjoyed most about life? What are some of those things they enjoyed most that you can take them and you can change them around that they still can enjoy maybe a small portion of them? Always re-examine a routine frequently, especially if you're noticing that your loved one is getting agitated, frustrated, or depressed. You may have to just adjust your expectations and as the disease advances, because they're not able to think the same way as they thought maybe when it was earlier on in the disease. They're losing more and more of the ability that they had when the disease first started. Routine is a tool, but no two people, as I told you, is alike, and no two people respond the same way. So it's up to you as a care partner to decide what works best for them. Okay, so why is the brain changing? What's causing the people to make bad decisions, to have problems to express to you what they're feeling? And they become frustrated and they're lashing out at you and you're not understanding. Well, here are some of the triggers that you can expect as far as a challenging behavior from them. One of them we've already talked about, overstimulating environment. If the TV is blasting, and maybe they used to love watching sports on television, but maybe it's those sports are moving too quickly for them and they can't keep up. Or maybe they used to enjoy watching war movies, but now the war movies are upsetting them because they're thinking they're real. Did you give them a task that was too difficult for them? If you did, they could become frustrated because they can't complete that task. Did you not challenge them enough? Are they bored? Believe it or not, people get bored because they have always done something in their life. And now they still want to do something, but you need to find activities that are worthwhile for them to do. How about you? Are you the agitated care partner? If they tell you one thing and you're frustrated and you're about to argue back with them, I'm going to tell you, you're never going to win that argument. If you find yourself getting agitated, and when you're a 24/7 caregiver, that is perfectly normal. If you find you're agitated, just excuse yourself, go into another room for a while, go do another chore, come back. You being agitated is only going to increase their agitation, and nothing will be resolved. Are you letting your care partner nap during the day? If you are, guess who's going to be up all night? They are. And maybe they didn't have sufficient sleep the night before. So keeping them active during the day and limiting the amount of nap that they're taking is critical. And tiredness does affect how they're going to function. Are they physically uncomfortable? Have they not gone to the bathroom in a few days? Do they have an upset stomach? Do they have a fever? Do they have a urinary tract infection? You need to look at their physical discomforts, because there are times during the course of this disease that they will not be able to express to you that they're in pain, that they're uncomfortable. So as a care partner, it's critical for you to know what their normal reactions are. But if you see them not acting normally, something's not right. Are you taking them to an unfamiliar environment? For example, you got called into work, and now all of a sudden you have to bring your mom over to your sister's house. And you think, well, she knows my sister's house. She's been there lots of times. Well, guess what? Maybe she has, but as the disease progresses, again, it's an environment she's not used to. And she may just want to go home where it's safe for her, at least where she feels safe. Is she having trouble communicating clearly? Are you misreading the signs? You have to be extremely empathetic and very patient, trying to figure out, not only with verbal, what other cues is she giving to you? What are her facial expressions? What are her gestures trying to tell you? This is one way you can help the individual that has dementia. So again, we talked about being sick. Maybe they have failing health. Maybe their eyesight is getting worse. Maybe their hearing is getting worse. Maybe they have another comorbidity that's giving them trouble. Maybe they're a diabetic and their insulin is off. Maybe they have a heart condition that goes along with this. Think about what they've lost. They no longer see their friends. They rarely see their family. So they become lonely, isolated, because many times the care partners don't have a conversation with them. And many times individuals become extremely depressed. And their loss of independence, their loss of moving the way they used to, the loss of them not having the abilities to do what they always did, and maybe they absolutely loved doing whatever hobby they had, for example, golf, and now they can't do it. But you can change that game of golf so that they can play a little bit. You just have to think out, as they say, think out of the box. So minimizing challenging behaviors. You want to first, it's the 3 Ps: prepare, prevent, and present. So preparing. As a care partner, many times you can anticipate a behavior. If you know your person pretty well, you may know that they cannot get ready quickly. They cannot choose an outfit out of their closet. And you're trying to rush them to go to a doctor's appointment, and what's going to happen is they can't understand why they have to hurry and move so quickly, and you're talking too fast to them. So what's going to happen? They're going to rebel. They're going to tell you they don't want to go. They're going to tell you, I can get dressed myself, I can do this. But meanwhile, as they're getting dressed by themselves, they're putting on 4 and 5 layers of clothing, and it's 90 degrees outside. So always prepare ahead of time. If you know you have to take your loved one somewhere, or you want to do it, some type of activity with them, prepare ahead of time, not at the last minute. You can't do things last minute with them. Prevent. So how can you prevent some of these triggers? By following that routine, making sure they have adequate sleep, making sure if their room when they typically go to sleep is dark and quiet, and maybe they like to listen to some very soothing music. How's the temperature in the house? A lot of times you put on the air conditioning and they're freezing to death, and some of them actually put on jackets. So make the temperature for them comfortable. Discourage napping during the day. Keep them as active as possible. Encourage that physical exercise, and definitely limit their caffeine. whether it be coffee, tea, they like Pepsi or Coke. Limit the amount of caffeine, especially past a certain hour in the afternoon. Always respond in the present. What's going on with this person? Did something happen before that upset them? What was the source of their frustration? Was it getting dressed? Was it taking a shower? Is it safe in the environment they're at? Is it okay if they're not comfortable doing a particular activity that you can leave them by themselves for a few minutes and go in another room? Always be aware of overstimulation. Something that's overstimulating to you may definitely be way overstimulating for someone who has a dementia. Here are some interventions you can use. Besides the daily routine, always provide a sense of security, caring, loving, taking a loved one's hand, reassuring them that you're there for them, that you care about them. Because as the Alzheimer's progresses, their skills and abilities change. And if we're still trying to do abilities and skills from when the disease first started and they're mid-stage, they're becoming frustrated with that activity. What about sensory stimulation? We know music, that's the one part of the brain that's not affected with Alzheimer's. So an individual who enjoyed music would love to listen to music. Aromatherapy, and you're thinking, well, what's aromatherapy? It could be as simple as taking different extracts out of the kitchen cupboard, having them smell them, asking them, what does the scent remind them of? What about, same thing with spices. Touch therapy, massaging their hands, especially if they're a woman, massaging them with maybe a lavender lotion, which definitely can calm someone. Doing their nails, reassuring them that you're there for them and that you're not going to be leaving them. Offering them a favorite snack. Asking them if they could help you. Can they help you dry the dishes? Can they help you fold towels? Can they help you sort a drawer? Can they help you sort coins? Could you help me? You would be very surprised on what their answer to you would be and their reaction. And I can't tell you enough about providing reassurance. They're worried. A lot of complaints I get is, my loved one follows me everywhere in the house. I can't get a minute to myself. It's because they don't know what's going to happen next. That's why a routine is so important. So providing that caring, loving touch and reassurance that you're there and that you're just, if they need you, just to call out because you're just in the kitchen. What time of day are they having these reactions? Is it when the sun is going down and they're sundowning? Is it midday when maybe they're starting to get tired? Always focus on enjoyment, not achievement. Are they enjoying something? Did they achieve it the way you would expect? It's not what you expect. It's, did you get a smile out of them? Did they enjoy the activity they were doing? Involving the person, as I said before, in conversation is critical. Talk to them. They're a person. How would you like if no one acknowledged your presence all day long? They should be respected. They should be loved. And so many of us, because of our own frustrations, forget that. I have a 5-minute video I want to show you on the reaction of a daughter with her mom. And it's worked for me before. It's a hyperlink, so I'm hoping that it's going to work right now. And be prepared or give me your reactions when this is over. Yes.
Can you pause?
Let me stop it.
Yeah. So you're sharing just your PowerPoint. So in order to share a link, you have to share your desktop. So that's okay. So I'm gonna.
So how do I do that?
I'm gonna stop sharing, and then you'll share again. But this time, just choose the top left option, which is your entire desktop, and then when you click on that, it'll open up your browser.
Oh, wait a minute. Okay.
So you're gonna reshare your screen.
Okay.
And then you see the top left one, that option. Sometimes it says desktop. It should be a picture of you in it or something.
Desktop, yes.
Yep. Click that and then press share. Okay. And then when you go back to your PowerPoint and click on that link, it will open up your browser.
Okay. Oh,
Whoops. There you go. Perfect.
you see it now?
Yeah.
Yes. Good?
My mom's become resistant to my help, and she's now hard to handle. She hasn't been able to manage her basic day-to-day needs without my help, but she believes she doesn't have any problems and doesn't need help. She's easily agitated and gets upset when I try to get her dressed. I'm just frustrated, and I don't know what to do. Mom, where are you? Mom, we're gonna be late for your doctor's appointment. Are you seriously planning on wearing that? It's 80 degrees outside, Mom. Okay, look, let's wear this instead. We don't have time, okay? Let's hurry. Mom. Oh, God, what is wrong with you?
Leave me alone. I can do it.
No, Mom, let me. Gosh,
Leave
let
me
help you.
alone.
I can help you, Mom.
I don't need your help. Leave me
Why
alone.
do
Get
you
out.
always do this to me.
Agitation and anxiety can manifest as difficulty sitting still, pacing, fidgeting, acting irritable, afraid, nervous, worried, or just being resistant to help from others. The behaviors are often triggered by a feeling of loss of control, misperceiving situations or actions as threats, unmet needs, inability to communicate clearly, and frustration with tasks or interactions with family and caregivers. Changes in a usual routine can also cause agitation and anxiety. People with dementia, for example, may have impaired insight towards their own cognition and ability level due to their disease. For this reason, they have a hard time understanding their limitations about what they can and cannot do. They may not realize that they need help, as they do not see themselves as having problems. This can lead to agitation when someone tries to help them. How one approaches a person with dementia makes a difference. If you feel angry, impatient, or frustrated, or if you rush someone or seem irritable, they can sense your mood and react with apprehension, resistance, anxiety, and agitation. Agitation can then escalate to inappropriate behaviors, such as hitting or biting. It is very important to remember that persons with dementia react and respond to how a caregiver approaches them. How you speak to them is key.
Good morning, Mom. How you feeling?
I'm all right.
Okay, what would you like to wear today? You look good in the green or the blue? Which color do you want to try
I don't
today?
need your help. I can do it myself.
I'm sorry that I made you feel that way, okay? You're doing very, very well, and I'm just here to help in case you need me. I know yourself very well. I love you so much, and I just want to be here when you need me. Can I stay with you? We can do this together? Okay, good. So we are going to go to the doctor's, and then we can go get some ice cream. How does that sound?
Oh, that sounds good.
Okay, let's get you dressed, Mom. Let's lose this. We want you to be comfortable after all. Let's see. Yeah, I think this is going to look good. Perfect.
Here are a few tips on how to respond to agitation and anxiety. Allow ample time to complete tasks and don't rush your loved one. Use a gentle tone of voice, but do not be condescending. Try to keep your body language positive and use calming gestures and a gentle touch. Don't be demanding or bark orders at your loved one. Instead, provide reassurance. Speak in calming tones and phrases. Let the individual know you're there for support. Try to schedule activities around your loved one's natural routines. For instance, if your loved one is a late riser, plan doctor's appointments for the afternoon. Simplify the environment to reduce frustration or confusion. For example, thin out the closet so that it is easier for your loved one to see inside. Have fewer clothing options to choose from, and clothes that are easy to put on.
Can you hear me, Marianne?
Yep, perfectly.
Okay, good. So I thought that was a great example of how a normal person would react. When they were coming in, their mom or dad was going to a doctor's appointment, they're doing what they're doing, and all of a sudden the spouse or the daughter is saying, hey, we have to get going. What are you doing here? And her agitation was passed on to the mom. Do any of you have any questions about what that little clip showed? So it really, how are you providing the care? Because I can't tell you how often the care partner is the one who will create some of these behavioral triggers. Either you might be doing too much, too little. You might not be communicating right. Maybe you're not adhering to what you know as their preferences. And if you have an outside caregiver coming into the home, give it time for your care partner to get to know who that person is before you leave the home. Always approach from the front. We went over this before. Eye contact, making sure there's a soothing touch. Talking slower, moving slower. Don't talk baby talk to them. Identifying yourself. As the disease progresses, they may not know you by sight, but they may know your tone of voice. They may know that you're the person who came in, who was kind to them. You may have to break down tasks into simple steps. Don't use negative terms, use positive. Ask short questions, maybe yes or no, and definitely limiting the number of choices. Maya Angelou has a quote that I'm sure many of you have heard. I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel. And each one of you can definitely make a difference every day. I want to thank you, and I hope I can answer some of your questions.
Well, thank you, Annette. That was really informative. And we did get some questions. I'd like to, Stephanie, can you just introduce Dr. Hardy? And maybe he'll have some suggestions for us, and we can ask him a couple questions to start off.
Absolutely. Dr. Hardy, can you wave for everybody? He was with us with our last presentation and just gave the science behind dementia, which was great. And we brought him here tonight. He was kind enough to join us so that if you have any questions, and I do have a couple of questions for Dr. Hardy specifically, but is there anything you'd like to add before we get started, Dr. Hardy?
No, I think that was a great presentation from Annette. I saw some questions streaming below, and I think she did get into some of those with the video presentation in the last few slides there. So I'm just happy to support and answer any questions anyone may have.
Great. Marianne, do you want me to go ahead with the questions?
Sure, go ahead.
All right. This one actually is for Dr. Hardy. It was sent to us earlier. This person's father was diagnosed with Alzheimer's when they were in their late 70s, and he lived to be 92, and he could still walk and talk a little. And they want to know what their chances as the daughter of getting Alzheimer's. She's 73, she's very healthy, but worried about the hereditary effects of the children of Alzheimer's sufferers.
Yeah, so good question. This is something I get in the office periodically as well. So one thing I do like to differentiate is, there are two types of Alzheimer's disease that we commonly see. There's early onset and then there's late onset. So the vast majority of cases we see are late onset Alzheimer's disease, which occurs after the age of 65. So in that scenario, the parent would have been over the age of 65. And really, there is a strong genetic inheritance of these abnormal genes, potentially. There's one in particular, but it's not just based upon one gene that you inherit. There's so many other risk factors that actually lead to the expression of the Alzheimer's disease clinically. So they're still investigating, so it's hard to give an actual number, but I say that as long as you're not in the early onset category, so your parent or sibling before the age of 65, then the actual risk factor of you genetically inheriting something goes down pretty significantly. So there is still a risk than people who don't have parents with Alzheimer's disease, but I wouldn't necessarily, especially at that age and no symptoms and no major comorbidities that can trigger this even more, that it wouldn't be that high of a risk. Hopefully, that was a long answer, I know, but hopefully that got it.
It's a heavy question, and I think that's a universal concern with families who have it in their DNA. They're wondering, do I have this gene? So it's great. Marianne, do you want me to just take the questions one by one? Is that okay?
Sure, that would be fabulous.
All right. So Marianne, I think you typed this question in for Annette. What are the best type of dishes? Like you mean like not food dishes, but like.
Yeah, so I've heard a lot, but haven't really done much research. But on the slide where Annette was talking about setting the dinner plate, the dinner table, I've heard that there's different colors of plates that you can use, different types of silverware that might help. And I just wondered if Annette had any research on that.
Yeah. Typically, as the disease progresses and they have a white plate, that's the worst type of color that you want to give them is a white plate. The best color to give someone who has like the advanced middle to advanced stages is a red plate. If you can't, some type of darker color plate so that they can see the differences on the plate of the food, because the white plate is almost like a hole. With their vision, they always experience difficulties. As far, you can get that adaptive spoons and forks that have the foam on the end, and they're slightly bent so that they can grasp them and feed themselves. And to be honest with you, as the disease progresses and they cannot eat with forks and spoons anymore, make sure you're serving them something they can eat with their hands. Cut up things that they can just pick up with their hands. Don't give them mashed potatoes, because they're not going to be able to get that spoon and eat. So give them the types of fruits, vegetables, chicken, something that they can pick up with their fingers and put in their mouth.
And can I expound on that to Dr. Hardy? Dr. Hardy, I remember with my own mother, when I would serve a dinner plate, it was almost like she ate half of it right down the center. And then I watched a video one time where they told me to rotate the plate as she was eating, and then she would, get a more balanced meal. Why? What are some of the causes that could cause, why does that help?
Oh, yes, another great question. So going to the anatomy of what happens, so there are different areas of the brain responsible for different activities in human life. So the two areas of the brain affected with Alzheimer's disease are parietal lobe and temporal lobe. Temporal lobe is more for your short-term memory, and parietal lobe actually, there's sensation there, but what we see in this scenario is it's responsible for your visual spatial perception of the world. So mostly everyone we come in and we do the standardized testing, you'll see us have them draw a clock, and sometimes they can ignore one side of the clock just because that parietal lobe and their visual spatial recognition has been affected as time goes along. So sometimes it's just putting the numbers on there, or just we can see this in strokes too. If someone had a stroke and the dominant side of their brain, parietal lobe, they can neglect one side of the world. So the same thing can happen in degenerative processes like Alzheimer's disease, or even other degenerative conditions. I won't get too much bothered by them, but that's what's causing that visual spatial recognition issue. So they're not really seeing the other side. They rotate it, and then they're able to see it in their vision again. So that is something we see as time progresses, and that parietal lobe, which is responsible for that function, is more affected. So that's what we see.
Okay, thank you.
And even, I guess to expound, even with driving too, we always get concerned about patients driving. So if someone comes to my office and they can barely have a clock and recognize both sides of the clock, I'd be very concerned about them adapting to oncoming traffic and seeing what's going on around them. And that's, again, because of that area of the brain that's involved. So that's one thing we assess with every visit for the most part.
That's great. Thank you.
Yeah. Well, the next question is for Annette, I would say. Do you have, holidays are a routine, but they're just not as frequent, like say Jeopardy, right? So is there a way to make it possible, for somebody, can you practice with them, and the potential chaos that comes with a holiday? Can you kind of practice in some way so that event is easier for them?
No. But you can adjust your holiday celebration. So if I'm assuming the people coming over to your house, I think it's from Jennifer.
Yep.
Can Jennifer answer?
Yeah, I this is just my imagination. I don't have a real scenario.
Okay. All right. So there are a couple of ways to handle this. If they're coming over to your house, then you're going to have to structure your holiday, maybe make it a little bit simpler. All of us have holiday traditions, and keep the ones that are most important to you. But one of the things, if a lot of people are coming over, it's going to be noisy, chaotic. The individual who has Alzheimer's may get a little agitated. Always find a quiet room in the house, and also a buddy, not just putting them in the quiet room, a buddy to go in and maybe talk with them, soothe them, listen to music if it's starting to get a bit too much for them. Families who have a loved one in a facility many times have asked me, what do we do? If we take her out, she wants to come back and says, I want to go home, because what they're bringing her to is not her home. She doesn't remember about past things that have occurred maybe in the past 5 years. So I always say they have no idea it's the holiday. So make the holiday special. Maybe have small groups of your family go and visit them in the facility, enjoy a tradition there that maybe that she like cookies, cake, maybe some type of meal that she enjoyed. Sit down with her, but do it in smaller increments so it doesn't overwhelm her.
I have a question myself. I just learned of somebody who's suffering from dementia, and she's hoarding.
Mm-hmm.
And I don't know that she was a hoarder before this, but maybe. Is this a feature, either Dr. Hardy or Annette, that you see it with the dementia person suffering from dementia?
Yes, definitely.
Yeah, I was going to say definitely yes.
Okay. So, that's a little tricky to manage because, this person is just going out literally every day and buying clothes and spending so much money. And if you try to take a portion of the stack, like from the bottom, she notices. And it's devastating for a lot of reasons. And I just was curious if this is common, because this is the first time I've heard of it.
Stephanie, is she living by herself?
No.
Okay.
No,
Is
she's
living
with
with
her spouse, her
She's
partner.
living with her spouse?
Yeah, I think her kids stepped in and overwhelmed by the reality of her situation, thought they could sneak things away, and that went very poorly. That was, unfortunately, she noticed. So,
Well,
I don't.
Who's taking her to the store?
She's getting there herself.
Maybe it's time to
Yeah,
look at that
like
situation.
an intervention.
Yes, so that one is a tough one, and we run into that a lot. What I typically try and do is when families are there in the office with the patient obviously doesn't want to, they don't think anything's wrong sometimes, or they think that's not as bad as it is, even if they have a little insight. So I usually would defer to some community programs that do roadside testing, or even through the Secretary of State, and I'll tell the patient, because at that point they're not severe, because you're still debating if they should drive or not. So I would give them the opportunity to prove themselves, and they're usually okay with that. You're not just stripping them all at once of their independence. You'll say, hey, let's go take this exam. If you pass it, you can drive, even though I know they probably won't. But if you pass it, you can drive. If not, then at least you can respect that third party opinion that that we probably should not be doing that activity anymore. Because a lot of times, coming from close family members, it may be taken not in a good way, or even the doctor. Sometimes people will listen to us, but if it's giving them a little bit of a chance to prove themselves, in my personal opinion, I think they actually appreciate that. And if they don't do as well as they're supposed to do, then I think they're a bit more willing to accept that, rather than us just telling them, no, you can't. The bad guy if needed. And one thing I do sometimes, I've had some family members, I haven't done it that often, or they'll say, just can you write it down in a letter and have my signature there stating what we talked about, because I was they may forget the conversation in the office, and then the family can just remind them based upon that sheet of paper and accuse them, saying, oh, okay, I see it. It is really true. You're not just telling me this because you want to take my keys away. So that's been beneficial in some scenarios as well.
In the state of Michigan, that any family member can go to the Secretary of State and tell them the situation, and they will send a note to that particular dementia patient saying they have a driving test or a test that they have to take. And no one's the bad guy, because it's the Secretary of State saying, hey, it's time for you to get tested.
Okay.
So a lot of times, families, I'm sure you see this, Dr. Hardy, a lot of times families don't want to have their loved one give up driving, because now it becomes a nuisance to them, because now they have to drive them everywhere.
Yeah, that's true. I have seen some scenarios like that.
Yeah,
Most
so
people
have
I
I.
think would be concerned, but definitely there's that dynamic as well, for sure.
Yeah.
In terms of the memory preserving medications, we don't. It's not a. I have seen some cases, but typically I don't see those really as being too sedating or But definitely the other ones, the mood stabilizers, the ones that help you sleep, it can go into the next day. So we definitely can see that. So in terms of the memory preservation ones, like your Aricept or Donepezil, and then your Namenda, which is memantine, or they have patches, Exelon. Usually there's a lot of GI side effects, and we usually dose them in the evening so people sleep through it. The Aricept can cause vivid nightmares at times, rare, but if it's not bothersome, then we just let people continue with the medication. But and then the memantine is pretty well tolerated. Some constipation may be reported. And sometimes with that medication, you can see a paradoxical worsening of the memory within the first month or so of giving it. So I usually warn patients, families about that. And then it usually goes right back to where they were and keeps them there, hopefully plateauing. But the sedation and sleeping more and kind of out of it, those are more of the like things like Seroquel that we use a lot, or some of the mood stabilizers, Depakote, or some of the SSRIs, your Lexapro, your Zolofts, things of that nature. So, because you have to think, everything's modulating the brain receptors. So I tell everybody, anything I give you for the most part has a chance of causing some fogginess, dizziness, because we are modulating brain receptor activity and neurotransmission. But which ones do it the most? I usually warn, significantly to that. But I hope that answers the question.
Yeah.
That's great. Annette, do you have time for one more?
I have time for one more, and I noticed that Adrienne Hooper said that the slides went by too fast for her to take notes. I would be happy to share my email address. I'll put it into the chat, and if you would like a copy of my slides, I'd be happy to share them with you.
So I think the last question this evening will be from, I think it was from my sister, actually. She's Jennifer Evanson there. She wants to know if you have any recommendations coping with the long-term aspect of grief and frustration, and just the worry and fear that you build up over time as you're managing and caring for a loved one with dementia. Do you have any help?
Yeah, it's something that I said during the first presentation I did.
Mm-hmm.
You have to have your team with you. You cannot do this alone. Either you have to go to a support group, you have to maybe take mindfulness classes, exercise. You need a partner. Maybe put your loved one in adult day services for a while so you get a break, either a half day, a full day, multiple days of the week. You need to hire a home care company with a caregiver if you don't have family that can help you. But you as a care partner cannot do this job alone. This takes a whole family, however your family, it could be a friend, it could be a loved one, it could be your children. You need a family to help you. And you cannot do this by yourself, because all of you definitely need breaks. Because what if something happens to you? Who's going to take care of that loved one? So you need to figure out who's your team. Who are the people you can count on so you don't have to do everything yourself? But don't be afraid of adult day services. It's a wonderful program, absolutely wonderful. They get entertained. Can you have a friend come over? If it's a guy, can you come over, spend an hour with my husband? So maybe I could go get my hair cut, or I could just take a walk. You need those people in your life that's going to help support you. I would just tell you, based on what she just said, is that you can't be everything to everyone, and everyone's not meant to be a caregiver. Mm-hmm. Don't feel like you failed. If you can't handle the situation, maybe you need to think about an alternative. And it's not that you failed at something. It's just maybe you're making yourself sick. Do you have the means to go to a facility? Can you do an adult day service to give you that break? You can start there small and take little steps. But there are some individuals who are just not meant to be caregivers. And if you're getting angry every day at your care partner, and you're losing your patients and screaming at them, and unfortunately I've seen this happen, you're not doing yourself any good, and you're not doing that individual any good. So it's better that you find another means. But don't think you failed. It's just that maybe you weren't meant to do that job.
Right.
I like that. That's a good way to put it, because I'm sure that many people have found themselves in that position.
Oh yes, it's 24/7, every single day. It's overwhelming. It is totally overwhelming. That's why the statistics show there are more caregivers pass away before the actual patient does.
Wow.
Right. It's the stress of caring for someone.
Mm-hmm.
And one other thing I tell in my grief group is, you know, you're going to have family, friends, neighbors that say, how can I help? And what's our reaction to that usually? Oh, I got it. I got it. So what you have to do is get your notebook and start writing down a list of things, little things like, you know, helping you with the laundry, or picking up your groceries on Tuesdays, or bringing your mom's favorite dinner on Sundays, or just make a list. And when someone says that, I tell them, and I go to my list and I say, hey, do you want to do this? Because what I noticed was something that makes me feel the best ever is when I get that perfect gift, or I do a favor for somebody. Oh my gosh, I feel so good. But when someone tries to do that for me, I don't let them. And that's just being selfish.
Mm-hmm.
So when someone calls and says, what can I do to help you? You know, you're overwhelmed. Don't take that as criticism. You know, get that list out, and it can be something easy as like, you know, my mom loves peanut butter on toast. I didn't have a chance to go grocery shopping this week. Could you mind? She likes the natural kind. You can only get it at, you know, Vincent Joe's or whatever. Make that list, because not only are you getting the help you need, but you're making someone else part of your tribe, and you're giving them such joy. Dr.
Well
Hardy,
said.
do you have any final words?
No, I think this was, you know, pretty well covered. Everyone had great questions. I always enjoy these forums. So, you know, I'd be happy, you know, answer any questions outside as well. And I'm sure you can provide my contact information, and everyone stay safe.
Yes.
Yeah.
I will actually, when this is done recording, I will send everyone the link to this presentation, and I'll also include Dr. Hardy's contact information.
Thank you.
And Annette.
And thank you, everybody, for
Okay.
joining us. Don't forget about September 23rd, the PTSD presentation with Dr. Lacoste. So
Yes.
thank you, everybody.
Okay. Thank you. Have a wonderful evening. Thank you, Dr. Hardy. Thank you, Annette. Thank you,
Welcome.
Stephanie. Bye, everybody.
Take care.
You're not alone.